Why does a headache occur? How can you relieve your condition at home? Which types of headaches are dangerous? Today, that's exactly what we'll be talking about. I'm Dr. Vasyl Chaika. Let's figure out headaches together. Medicine distinguishes between different types of headaches. For example, migraine, tension headache, headache due to cervical osteochondrosis, or during acute respiratory viral infections. And for each of these types of headaches, of course, there are specific treatment options. But there is one very interesting point that you should know. There are no pain receptors in the brain. If there are no pain receptors, then why does a headache occur? Does it mean that there might be something wrong with my head? This is the most common question people ask when they have a headache. And you need to understand one very simple thing, and you can check this yourself. Headache as a phenomenon occurs because the amount of fluid in the brain increases. In a certain area, you could say, of the brain. This leads to increased intracranial pressure, and it is this that causes the headache. And this will happen with osteochondrosis, with migraines, with stress, with acute respiratory viral infections, and with high blood pressure. All of this will happen. Let's now go over the reasons together, what actually leads to an increase in the amount of fluid in the brain. There are physical causes of headaches. That is, physical causes. An increase in fluid at the level of the brain. What exactly is this? It's, of course, any disorder, anything that leads to impaired fluid outflow. What is that? Could it be a problem with the arteries? No. For example, it's muscle spasms, displacement of the vertebrae in the cervical spine. All of this leads to compression of the veins and venous plexuses. Because of this, the blood flow to the head is normal, but there is a problem with the outflow. More blood and lymph accumulate at the level of the cerebrospinal fluid, at the level of the brain. As a result, we start to experience increased intracranial pressure and a headache occurs. And it's actually very easy to deal with these causes. And today, I'll tell you how you can handle this. The second cause is the so-called emotional component, or more accurately, the reflex component. The point is that our brain contains centers that control all our organs, and even groups of cells within a given organ. And so, if a recovery process begins in the organ affected by inflammation, the same kind of inflammatory process with fluid accumulation actually occurs at the level of the control center in the brain. And what does that mean? There will also be pain there. And in such cases, it's important to know certain specifics, and today we will also talk about them with you. It's important to remember that it doesn't matter whether the headache is caused by a physical component or by a reflex component. You need to pay attention to headaches because, the brain is an extremely important center. If you develop a headache and all the control centers are located there, it could be brain swelling or it could be some other reason. So your task is to use the algorithm I'm about to explain, and if the headache doesn't go away, your job is to consult a specialist so they can conduct additional tests such as an MRI or a CT scan. So let's start with the algorithm. What should you do if you have a headache? So first there's the physical component. How do you identify it? How do you distinguish it from the reflex component? The physical component is associated with muscle spasms, displacement of the vertebrae in the cervical spine, and swelling that occurs in the neck area. We can easily detect this simply by performing what is called palpation, that is basically by touch. And we can do this, for example, with our fingers, or for instance, use something as simple as this marker I have here, which we can use as well. What do? We take it and press like this on the muscles. In the area where we feel intense pain, we don't press lightly, but firmly. If intense pain appears, this area is actually the cause, for example, of muscle spasm, swelling, or even bruising of the same vertebra. This will cause impaired outflow, and we need to work through this area. Where should we start? With which area? So first we should start with the area where the skull attaches to the neck. It's very easy to find. As you can see, there's a protrusion here located behind the ear. It's called the mastoid process. And right behind it, in this little hollow here, which you can also easily find by tilting your head back, that's where the first point is located. So it's very straightforward. You just take your hands like this and place them on your neck. I'll show you from the side like this. This is how it's done. It's easier to check like this. And in this way, you apply pressure. What's important? If it's a physical component, then when you press, literally after 5 or sometimes 7 seconds, the pain intensifies exactly in the area of the head where it usually radiates. This indicates that it is indeed a physical component. So if that's the case, you find this point, select it, press, and perform a massage. That is, you can massage clockwise, counterclockwise. It doesn't matter how. But what's important here? The important thing is that for the first 10 to 15 seconds, the pain will intensify. Then, during the next 30 to 40 seconds while you massage, the pain should decrease. And then, once the pain has completely disappeared, you should continue massaging for another 20 seconds. If your fingers get tired quickly, we can use auxiliary tools. For example, a marker like this. We can also press like this, hold for 10 to 15 seconds, and the pain should intensify. Then the pain doesn't decrease, the pressure, the pain. It weakens, and when it has completely disappeared and you feel warmth in the area where you were pressing, then after 20 seconds you can completely remove the marker. And you need to go through all these points, starting from where the hairline ends on the back of the head, along the back of the neck, all the way here to the trapezius. In this way, you will work through the neck, and this will help you relieve the physical component. What else can you do additionally? You can take a roller, an ordinary roller, and lie down on it. That is, you lie down horizontally on a hard surface, roll up a small roller. Its diameter should be from 7 up to a maximum of 15 centimeters. And you need to place it right here, where the hairy part of the head transitions into the neck. I'll show you again. Right here, where the scalp meets the neck. Do not place it under your neck. Let me emphasize this again, because that's a common mistake. But specifically under the spot where the skull transitions into the neck, essentially under the first and second cervical vertebrae. What will this lead to? If you place it like this, you will experience what is called traction or stretching. This will help reduce the load on the muscles will relax, and of course, this will lead to improved drainage. In this way, you can lie like this for 10 to 15 minutes when you have a headache, for example in the evening, or if possible, during the day. If you don't have a roller and can't make one, that's okay. You can take, for example, 2 tennis balls. Put them in a stocking. Tie the stocking so that the tennis balls don't move, and also place it under this area. Of course, during the first 10 to 15 minutes, the headache will intensify, and that's how it should be if it has a physical component, but then it will subside. So in fact, this is how we can work through the physical component. Additional methods like warming, rubbing, various types of massage using vacuum cups, gua sha massage, all of these help. But first, what do you need to do? You need to check whether it's a physical component or a reflex one. And we've already discussed how to check for the physical component. Now let's move on to another option. Now let's go over the reflex component together. We know that any tissue will only heal through inflammation. So what is inflammation? First and foremost, it's the accumulation of fluid. This fluid will accumulate both in the area where the tissue is healing and in the control center for this tissue at the brain level. This can be very easily verified. For example, please make a small scratch or a cut on your skin. And you'll see that literally within a couple of minutes, the edges will turn red and the skin will start to swell up, one part rising above the other. What is this? This is swelling. So this is a very simple explanation that you can check for yourself that this is really the case. So how do we deal with this swelling? Our main task here is to reduce it. The flow of blood to the brain. Specifically to reduce it, I want you to hear this. Not to increase it, but to reduce it. How can we do this? So first we need to reduce fluid intake, because the more we drink, the greater the volume of circulating blood, and the more the heart and vascular system will pump blood into the brain. So what do we need to do? Reduce the amount of fluid when we have a headache. It doesn't matter if it's a cold IRV or a migraine. Whether it's stress, it doesn't matter. We reduce it to 300, maximum 500 milliliters per day. That's the total amount of fluid you drink. This applies to adults. If this situation occurs in children, they drink as much as they want. You don't force them. A huge mistake is thinking, oh, you have a headache, you need to drink more because it's intoxication. This leads to even more fluid accumulation and an even worse headache. That's the first point. The second point from before. How can you reduce swelling of any tissue? You apply something cold. So we can use an ice pack or, for example, freeze a bottle and apply it to the area that hurts. But what if your whole head hurts? What should you do then? Then you can just take a regular hat, wet it, put it in the freezer so it freezes, and wear it for 10 to 15 minutes. But won't my head catch a cold? Won't I get sick from that? No. 10 to 15 minutes is enough to cool, let's say, this part of our body and partially reduce the swelling. Additionally, we should also add various types of diuretics. The best diuretics are always plant-based, not chemical but plant-based. Why? Because they don't cause fluid retention again, which would once more increase the headache. So for example, any herbal diuretic blend, any diuretic mix you find at the pharmacy, you can take and use when you have a headache. It doesn't matter whether it's due to a respiratory infection or, for example, a migraine. This will also help. How many times a day should you take it? Once at most. Remember that the total daily fluid intake should not exceed 300 to 500 milliliters in total for adults. What else can we do additionally? Coffee. Coffee such as Americano or espresso, for example, where there is actually very little water, we can drink it. Why? Because coffee contains caffeine. And it's caffeine that is, or rather caffeine has a diuretic effect. So by drinking coffee, we get a mild diuretic effect. And this will also help us. If you have a headache, you drink a little coffee. But what if my blood pressure goes up? Then what? Then I drink coffee and the person says that my blood pressure rises even more. We are not including blood pressure here. Because when blood pressure rises, a completely different kind of help is needed. What else can we add? A bath, a salt bath? Why? Because pain occurs due to the accumulation of fluid in a certain area. And this mechanical distension, that is, this mechanical effect of increased fluid volume, causes the sensation of pain. So when we immerse ourselves in an isotonic solution in the bath, how do we make it? For 100 liters of water, use 900 grams of regular table salt. The water temperature should not exceed 36 to 38 degrees Celsius. If it's higher, the swelling will increase. And in the room where you are staying, the ventilation should be working very well because, for example, if someone opens the door, you are lying in this bath and staying there for an hour and a half to 2 hours. This helps the concentration of ions, salts, and other substances where the swelling is to move into the bath, and this also reduces the swelling. In other words, quite simply, due to the concentration gradient, the swelling will decrease. By using these simple methods, you can help yourself on a reflexive level. But there is one more very important point here that most doctors don't talk about. It's your attitude. If you perceive a headache as some kind of danger that has attacked you, and now there's something wrong with your brain, it's broken, it's defective. In other words, you're actually lowering your self-esteem intellectually. What will this lead to again? To a repeated occurrence of swelling. That's why you need to understand that when your head hurts, swelling occurs there, and when swelling happens, it's a physiological healing process. And if it's a healing process, then it's normal, it's the rules of biology. But when should we actually pay attention and see a doctor and, for example, get an MRI or a CT scan? When you follow this algorithm for 1 to 2 days and there's no result. In that case, it's better to do so. That is, if there's no relief at all, or, for example, the headache actually gets worse. If you followed the algorithm and by evening the headache has intensified, then it's better to get an MRI or a CT scan. Use this algorithm and live without headaches. This was Dr. Vasyl Chaika with you.